Okay, so I've done my TED Talk on physician-assisted suicide, or more commonly known as euthanasia. A little different. So what it is physician-assisted suicide is the loss of life due to the assistance of a medical physician, usually by them prescribing a lethal dose of a drug. So when someone lets it be known that they are suffering, or if they're in some need and they would just like to die, then they request a lethal dose of their drug from their physician and it's prescribed to them. It's usually taken at their discretion, so whenever they feel like it, whenever they want to, but in some cases, or more known as euthanasia, it can be considered the same or related, but the doctor usually gives them a lethal injection for them to die. So when it's implemented, it can be implemented in lots of circumstances. So most commonly, it's when a patient has experienced loss of dignity, when they think that their illness or their sickness is too much and they don't feel like they have the dignity that they once had in their life, or if there's too much of a reliance on their families. If the patient is rely on family for them to get around, feed, if they can't live without them, then sometimes they feel this way. Also, a lot more commonly is to relieve suffering from a terminal illness. So if someone knows that they're going to die and they are in pain, if they're suffering, then it's implemented a lot. And in these cases, it's a lot more widely accepted. Today in the United States, it is legal in some cases in those 4 states up there: Oregon, Washington, Montana, and Vermont. Oregon passed a law a while ago, a couple years ago, called the Death with Dignity Act, that allows some cases to be allowed, but also in other countries such as Belgium, Switzerland, and Norway, I believe, it is legal. Why it's an issue today? So physician-assisted suicide is actually a big issue in the legal world, but it's not as widely known because there's a lot of legal issues that come with it, because it is death. It's unlawful death of someone who, should they be allowed to commit suicide, or is it considered murder from a doctor? Nobody can answer the questions really. So right now, one of the questions is who can actually request physician-assisted suicide? So questions such as, is it when someone is in too much pain, or who can request it if they are mentally stable? One story that came from an article was a woman in Switzerland had requested to be killed once she reached a point of life that it was not desirable for her to live anymore. So she was diagnosed with Alzheimer's, and at that point, when the doctor and her family decided that she did not have the quality of life, then they decided that it was then her time to go. So the doctor spiked her coffee with a sedative, and she was put on the table to be lethally injected as she had requested prior. But while on the table, she woke up and started to struggle as they lethally injected her, and she was killed. Now, even though she had previously requested to be put to death at this time, who's to say that she still wanted to, because her mental health had changed, or maybe her opinions had changed, but she couldn't explain that because of her mental health. So that's one issue that comes with it. Another issue is a right to privacy, because in the Bill of Rights, it gives us a right to privacy, and who's to say that your right to privacy doesn't mean that nobody can know what you want to do and what you're going to do with your own medical and your personal life. One quote from Sandra M. Alters, who's a big author on this subject, was, "The acceptability of euthanasia and physician-assisted suicide by the general public appears to depend on 4 factors: the level of the patient's suffering, the extent to which the patient requested death, the age of the patient, and the degree to the curability of the illness." So if an illness is completely curable, what's to say you can or cannot accept it? And also the age of the patient. Is it just given to patients who are above a certain age who have lived a good life, or is it given to anyone? A child with a terminal illness that knows they're going to die within 6 months and is suffering extremely. There are a couple considerations with physician-assisted suicide. The first being the ethical, the moral wrong that comes with it, the fact that it is unlawful death of someone. The doctor has to prescribe. One point made is the Hippocratic Oath that doctors make, that they won't do harm to a patient. that they won't prescribe any deadly medicine. How does that relate to a patient who is in more pain without the medicine? Also, euthanasia and physician-assisted suicide puts a lot of trust in institutions and doctors that can't always be reliable in making their decisions. So whether they have a moral obligation not to, or to help someone out, that can be an issue. And what family members are allowed to speak, whether family members closely related or not should be able to speak for someone who can't technically speak on their own behalf if they have dementia or Alzheimer's. In addition to this, legal considerations such as, is it considered murder, and the room for error. So if lethal injection or perhaps an overdose of a lethally prescribed drug for euthanasia doesn't work and perhaps they survive, what are the legal backfires on the institution and the doctors that prescribe this? Because then the people who requested in the first place are paying more money, and it's more difficult for them, and their quality of life goes down even more. In conclusion, I believe that physician-assisted suicide is too hard to regulate. When I first started researching this topic, I thought that it was a noble cause, and I really believe like ending someone's suffering if they have a terminal illness and too much pain could definitely be a good cause to work for. But I believe there's too much difficulty in regulating the legal and the ethical considerations of ending someone's life, depending on whether they want it or whether their family wants it, or how hard it is on them. I think that the solution to this would be more advances in end-of-life quality and medicine. So growing and improving that end of life for people with terminal illnesses and that are in pain. In addition, more advances in medicine to improve and help people that are requesting this so that they don't have to.